Hi, I'm Dr. Harrison. I work at Advanced Medical Solutions. I'm the main chiropractor here who treats the patients. Today I want to talk about those patients who often other doctors have given up on, because it seems like we see a lot of those patients. They've been to a lot of other different facilities, whether it's medical, chiro, rehab, even other patients who've been to regenerative medicine facilities who just haven't gotten the results. We see a lot of patients who will say, my doctor looked at my x-rays and said, I can't help you. And they kind of come to us as sort of a last chance to find somebody who will, fight for them. I feel like that's kind of my philosophy is I just don't like to give up on anybody. And we see quite a few of those patients. We push them. We help them through some of the difficult stages of care, because a lot of them are hurting really bad, and because of that, they're very hesitant and limited in what they can do. And we're here as a team to encourage them to just kind of fight through some of the difficulties that they're having, whether it be movement with particular joints, knees, shoulders, back, you name it. A lot of times they're just afraid to work through some of the pain that they're experiencing, and it's our job to encourage them and let them know it's safe and that it's okay to do that, because a lot of them oftentimes have been taught that anything painful is bad, but I always kind of use the analogy that when you take it, if you have a splinter and you take it out, it's painful, but the result is that finger will now heal. If we left the splinter in there because it hurts, then you have the chance of it getting infected and getting much worse. So there's some pains that are worth working through. And with the things that we do here, between the chiropractic, the rehab, the regenerative medicine, even the nutritional counseling, the hormone therapy that we provide, all these things work together sort of synergistically to help patients work through that pain. And so I always like to use I like to encourage patients that the healing is sometimes on the other side of the pain, and you have to work through it. And it's our job to provide and recommend the treatment necessary to help them be successful at doing that. And so many other doctors will give up on patients because sometimes it's difficult to help somebody through that process. Another analogy I like to use, it's like parenting. Some parents discipline their kids even though it hurts, but those kids come out way better for it. And then there's other parents who decide just let their kids do whatever they want because they don't want to deal with the inconvenience of that discipline. And then then later on in life they find that a lot of times those kids run into difficulties. And so it's just knowing when to push somebody. It's okay to be a little uncomfortable when you're working through things, knowing that the outcome is going to be well worth it. And so that's kind of what I wanted to discuss today. Is here at AMS we're not going to give up on anybody. And I've been amazed because there are patients where I kind of get to that point with them where it's like, boy, I don't know if I can do anything else, but I just kind of keep that hopeful mindset that I'm just not giving up. And then the next thing you know, they're coming in that next day and they're like, you know what, I had a breakthrough. And I'm like, I'm just that, and I've had that lately. I've noticed that a lot in some patients, and it's just encouraged me to kind of speak up to those patients out there that everybody else has given up on, and just encourage them to just keep fighting. And we are here to fight for you.